We are going to now move on to our behavioral cases. We're going to have cases of bullying and self-injury. So we'll go ahead and start. I want to introduce our speakers. We're going to have on the veterinary side, Dr. Melissa Bain. Dr. Bain is a board-certified veterinary behaviorist and is chief of service of the clinical animal behavior at UC Davis. She is current president of the American College of Veterinary Behaviorists. We also will be having Dr. Victoria Voith. She's a professor of animal behavior at Western University. She is a pioneer in the study of the behavior of companion animals, the diagnosis and treatment of animal behavior problems, and the human-animal bond. On the human side, we're going to have Dr. Jaana Juvonen. Dr. Juvonen is a professor in the developmental psychology program here at UCLA. Her research focuses on peer relationships, specifically bullying, and school adjustment of young teens. And for our self-injury case, we're going to have Dr. Mark DeAntonio. Dr. DeAntonio is a clinical professor at the Semel Institute for Neuroscience and Human Behavior and the director of Inpatient Child and Adolescent Service at the UCLA Resnick Neuropsychiatric Hospital. So thank you very much, experts, and let's start with Dr. Bain.
So, good morning. This has been a fun day so far, and I'm going to present a couple of cases of household pet aggression, which hopefully will have some correlation to bullying behavior. So first I'm going to present Harper and Ramsey. They're both 2-year-old male castrated corgis. When you see the video, Harper has no tail and Ramsey has the tail. Harper came in the household at 8 weeks of age, and Ramsey came in at 8 months of age. The presenting complaint was being aggressive toward the other dog in the household and bitten people who tried to separate the dogs. So basic information, 2 adult owners and 1 cat. We have to present them all. Ramsey has a history of ischemic dermatopathy being treated by the veterinarian. It's fairly well managed, but he requires a little bit more hand-holding than does Harper. So history, initially Ramsey would, when the fights would start, Ramsey would leave, but now he's been fighting back. But what the owners noticed is Ramsey never instigated any altercations. So they would fight over toys and rawhides, and when the owners would give attention, especially when Ramsey would get attention in regards to his medical care. Harper will bark and snap at Ramsey also when he's coming into the house. If the owners interfere by trying to break them up and subsequently getting bitten, it does escalate. Typically they grab around the head and the neck to separate them, and both owners roll and pin dogs. So who here has corgis? Okay, tough dogs, eh? Yeah, okay. A, it's not correct, and B, they're tough dogs, and that's also when they would get bitten. There was no evidence of fighting when the owners were gone. They never came home to any blood, no injuries. Everything was fairly good when they came home. And they did get along otherwise when they weren't fighting over these resources, over entryways, or when the owners were interfering. The owners were planning on having children in the future, so in the actually relative near future, without any help for in vitro fertilization, according to the owners. So here's.
You can see how Harper just gets very aggressive when he's on the other side of the window from Ramsey.
So not only stressful for the dogs, but also stressful for the owners. And here's a little bit more. Harper's also aggressive toward other dogs. I'm not going to address that, but here's them on a walk. Dogs are walking the owners, not vice versa.
Harper, come on.
You see at the end, it's interesting. So they're fighting, barking at a dog hiding behind the fence, and then Harper would redirect toward Ramsey. So our diagnosis, the terminology we used is dominant status aggression between the dogs. This has nothing to do with popular press and people on the television shows calling dogs dominant. This has to do between the 2 dogs in the household. Between the 2 dogs, Harper had more access to these priority resources and actually cared about it more. The owners were aware of the avoidable triggers, and it was relatively easily managed if they were the owners were able to follow the instructions. But keep in mind, Ramsey was their favorite little dog because he was sick. And they cared for him, and they took good care of him. And then Harper started all these things. Harper's the little troublemaker, shall we say, according to the owner. So this, you can see how the owners play a big role in these problems. So our treatment for them, first, educate the owners to say, you know, you're playing a fairly large role in their issue, and talk about what their hierarchy is within the animals, and to really work, first of all, do they have to get raw hides at the same time? No. Do they have? So a lot of it was just avoiding some of the triggers, and not normal of my treatment plan, but is to keep them separated when the owners were gone. The wife particularly, was incredibly worried about fights escalating when they were gone. Consistent owner interactions and leadership. This takes probably half hour to describe to owners. I have 5 seconds. It's to essentially make the dogs respond to the owner so that the dogs have a consistent way of interacting with the owners in the house. The household life is a little bit more calm. Support Harper is a more dominant dog. Between the two dogs, he gets priority access. Now imagine he's the troublemaker, according to the owners. Now they have to feed him first. They have to let him out the door first. So this is emotionally hard for a lot of our owners to do. And then essentially when the fights would start, we just said, you know, you're a big part of this. Can you just leave the room as soon as Harper kind of gives a little look at Ramsey? And they did it. The wife was very nervous. But 2 weeks later, the fights had stopped just by following this very simple interactions. Now, this is a pretty normal case, pretty typical situation between these two dogs. So this is no real pathology here. And then they continued to improve over the interactions. So that's one case. I have another one, Cinnabon. Cinnabon is an 8-year-old female spayed domestic short hair who presenting complaint was severe aggression toward one other cat in the household. 2 adult owners, 5 total cats, which 2 less than Crazy Cat Lady. She had a medical history of allergic dermatitis. We took her over to dermatology and had her worked up there as well. So she had pyoderma and bacterial otitis in both ears. So she uncomfortable. So Cinnabon seeks out and attacks Twinkle. So Twinkle was previously a feral cat, not quite a feral cat. The owner called her feral. She was actually quite socialized to people. And then there was the bat incident. Now, when you hear the owner's voice on the video, you'll understand his owner also was a high-intensity woman. But rightly so. I mean, the cats carried a bat into the house. And everybody was in a kerfuffle, and Cinnabon started chasing Twinkle upstairs, and so she kept a baby gate to separate the cats. But Cinnabon would stalk the gate, would crouch, growl, pin her ears, and thump her tail towards Twinkle for months. And then Cinnabon would breach the gate and actually open the bedroom door, a lever door, and attack Twinkle. And Twinkle would urinate and defecate when she was chased and attacked. So, oh, that's right, sorry. I'm not looking at you, nope. Are you
going to talk to Cinnabon?
So here, this is Cinnabon, is the more Siamese, that's Twinkle.
Having a silent conversation? About who's the alpha? I think you are.
But you can see lots of toys, lots of enrichment.
Twinkle.
Oh.
What do you want? What? Is it dinner time?
No, this cat's staring at me.
Dinner time?
Get him.
Is it? Huh? Is it dinner time? Better watch out for Cinnabon. Yeah.
Oh! So, not really typical what we would think. So with them Cinnamon wasn't quite normal, what we would normally expect. So for that household, as management, we said, how about move another baby gate at the bottom of the stairs? This was upstairs, and just so she doesn't have to go through 2 gates to attack poor Twinkle. And Twinkle doesn't have to stare at the darn Cinnabon. Cinnabon kept staring at her. House of Plenty, lots of enrichment, so so Twinkle has opportunity to not be stared at by Cinnabon. Gradual introduction via desensitization and counter-conditioning. And we did prescribe amitriptyline, which is not a first medication of choice for me, but because it does have some antihistaminic properties and Twinkle has allergies, we prescribed that for her. And then much improved in the email, I was able to play with Twinkle outside her bedroom door for quite some time, and they actually stayed in the computer room together. So, pass it on to the bullying expert. More normal behaviors.
Well, I'm going to warn you, I'm not going to be as entertaining because now we're talking about bullying among children. So I'm a developmental psychologist, and I will talk about our research and not really show any particular case studies. So this is slightly different, and I'm going to be slipping through some slides quickly. So bear with me. So rather than using the term aggression, I'm going to be referring specifically to a subtype of aggression, bullying, where there's a clear imbalance of power between the perpetrator and the victim. And among humans, obviously, this can be accomplished by various means, not only by physical aggression, but words are often very intimidating, belittling, and humiliating. But moreover, we have these covert tactics that kids often resort to. Relational aggression refers to exclusion, backstabbing, spreading of rumors, and of course cyberbullying refers to many of these tactics being used via the various electronic communication devices that kids are interacting with. So I'm going to skip through some examples here, but what we do know about aggression, this kind of bullying behavior, is that often bullies indeed have high social rank. So among kids, we talk about coolness, as you can see here. The bullies compared to the midline, where the uninvolved kids are, they are much more popular, whereas the victims are much clearly uncool or unpopular. And this is true for different types of or forms of bullying. And one of the questions we've obviously had is bullying a way to gain status, to boost one's status over time, or is it just that high status individuals are using or abusing their power to put down other individuals? And in large longitudinal studies, we can test the directionality of effects, and indeed what we find is support for these bidirectional effects for both physical bullying and relational bullying. In other words, aggression or bullying is a way to both boost status and to maintain it. So I'm going to give you now here, bring you to the schoolyard and show you an example of this kind of imbalance of power. And here in this case, I want you to pay attention to who's the likely target. The likely target is someone who is a loner. This kid is by himself, having lunch. Prime target, safe target. Watch the reactions of the bystanders. So it's the combination of these bystander responses, the snickering, the laughing, and this fearful reaction, submissive reaction of the victim that are very rewarding to the bully. So you can understand why the bully has cool status. Now, as developmental psychologists, we are particularly curious when bullying or its coolness peaks. And what we have discovered is that it's bullying is at its worst in large settings, in unstructured settings, and particularly during times of transition. So, for example, when kids are moving from elementary school to middle school, bullying peaks and becomes very associated with this high status. So, what are the ways to try to explain these findings? One way to think about this is that bullying serves a very important social function. So it is a way to form and maintain a social hierarchy. And for kids, during the times of uncertainty, when they are in a large group where they don't know where they fit in, it actually can serve a purpose. It helps them navigate through the setting. It helps them figure out who to form alliances with and who to avoid. So it actually functions the way it functions among animals. However, if we think about interventions, you can see that the typical interventions that we used to have a lot, focusing on aggressive kids that are totally individually focused, are probably limited in light of this group function of aggression. So we really need to understand both the motives, the power hunger of the bullies, as well as its how it plays out within the group when we try to intervene. Although we can deal with physical aggression in part, curb it by increased monitoring of the hotspots in the schoolyard, if we really try to address all forms of bullying, including these more covert types, we need these much more systemic anti-bullying programs that are really designed to empower the bystanders to challenge the power of the bullies. They become the critical part of the intervention. And before I close, just a few words about the plight of the victims. We know that that most of the signs of the victims are quiet signs. That is, we often fail to detect and or misattribute these symptoms, quiet signs of distress, some of which are physical. And in part explain why kids, for example, start avoiding going to school and really disliking school. And one of the ways in which the distress really comes about, the psychological mechanism, is that these kids who repeatedly get victimized or bullied, they come to believe it's their fault. And that's what elevates these signs of distress and withdrawal symptoms. So what might be then the antihistamines that alleviate the distress of victims? Well, we have to work on the cognitions, the maladaptive thoughts, that is, make them believe that that it's not just about their fault, it's not them, but we can help this thought in part by building their friendships. That is, that they realize that they're not alone, they have somebody there to resort to. And the power of friend is incredible. A kid with just one friend initially gets buffered. That is, they have a lower risk of getting victimized, getting bullied in the first place. Moreover, the distress of is alleviated when they have that friend. But if we really try to think about this as a systemic problem and fix the collective problem of bullying, we need to work on those bystanders and get them to be the upstanders. Thank you.
This is not self-injury. Okay. I'm going to talk about a relatively unusual type of self-mutilation that occurs in animals. And this is the story of the little spinning horse. This is a picture of a 4-year-old Arabian stallion that was purchased over the phone by somebody in California. The horse was in New Mexico at this time. The person purchasing the horse from California had seen the horse when it was two years old, and it was the most beautiful little Arabian stallion this person had ever seen, and it was an incredible horse. And the purchaser had known siblings of this stallion, of this particular horse, that were also very good, and found it was for sale, purchased it. After the purchase, the horse was sent to a trainer, who then called and said to the owner, It's doing strange things. It looks like it's trying to bite its penis. It's reaching around and biting at its flank area and its penis area in the stall, and doing a lot of fence fighting over the fence. The owner was a little concerned about that because she knew that this horse had been raised as a solitary horse all by itself from the time it was 4 months old till 4 years of age as a stallion. And there's a syndrome in stallions that are confined and kept away from all other horses where they do self-mutilation. She immediately looked up things in the books that were available, and one very encouraging book said castration will cause cessation of this problem about 70% of the time, curative. So she thought, fantastic horse, 70% chance of cure with castration, keep the horse, keep persisting with owning this horse. So in the interim, the horse was sent to another facility who the facility personnel called the owner and said, you got to come and get this horse. It's going crazy. It's not happy here. So the horse was taken from there, castrated, lost a lot of weight at the other facility, shipped to California. In California, within days, when a person wasn't with the horse, he would spin in the stall, squeal, kick the sides of the stalls and rafters. He could kick vertically with his back feet, kick suspended fly attraction bottles on the ceiling. When let out, would spin, run in circles with head tilted to the outside of the circle, neck often outstretched as he ran, and would swirl and bite his pectoral muscles, his sides, and go after his legs. In between these things, this horse is a sweetie pie. This is a picture a year after he arrived in California. I hope this works. Oops, how do I run the video? It should be embedded in there. Okay, so this is a year after the horse had been castrated, and typically when he's let out, he goes and he sniffs feces, which is a very common, this is a gilding now, but very common stallion behavior, and then to defecate on the fecal pile. And then after he would do this, and this was a sweet horse. You could ride him, you could walk under his belly. He was gentle even as a stallion to people. And then a short time after being left out, and sometimes this would happen in stalls, he'd start lifting his back leg, kicking a little. Then he would start this running and bucking, and then kicking. Now this is much less intense than it was when he was a stallion and shortly after he was castrated. So this behavior is decreased in intensity. And you could distract him sometimes by yelling at him or screaming at him and throwing things at him, and he would stop. But he would actually literally wound himself. And there's somebody yelling, hup, and that would sort of sometimes distract him a little bit. And the volume is not up very high on this, but you can actually hear his teeth snap very loudly as he's going for his legs. You know, and here you can't see too well, but here are wounds on his hips, and on this line from his hip to his pectoral area, you will see wounds like this. And this is hardly anything compared to initially the wounds. So these wounds go across that whole horizontal area, the pectoral areas, etc. He was treated with antihistamines, bathing things, put rubber mats in his stall, tried reducing high-energy diet, more exercise, everything, and it's better, but not completely better. And here he is, he's stopping the behavior and coming over to be petted. Never tried to attack a person. He would direct this at himself. So this is some of these same ones we just saw, but the slowed down 50% real time. And it turns out these sequences that he's going through are commonly reported in histories of horses with this self-mutilating behavior, including the sniffing the feces, the reaching around, sniffing their own inguinal areas, and the kicking with the back feet, and then the big kicking, and then the biting. The owner, before she continued to investigate in the horse, when she first found that it was investigating its inguinal area at the first trainers, called the veterinarian who knew the horse in New Mexico, who said it was a wonderful horse. It was sweet, it was gentle, it was a character. It would spin and chase its tail like a dog. But that evidently was all it was doing at its original location, which was a farm that had llamas and a crop farm and no other horses. But what it did was spin and chase its tail. It was separated from its mother at 4 months. Most time horses stay with their natal band for quite a long period of time. They don't really become fully weaned off until they're about 6 months old. And he could keep this up for an extended period of time, unless you interrupted him, distracted him. It could be elicited by any time he got distressed. If there was noise from sanding that was going on at a neighboring construction site, he would start this behavior. If he was transported, he would start this behavior. Okay, so we're, I think, circling back. Okay. So the owner tried many things, which included stalls adjacent to the horse with another horse that he could interact with and groom, exercised many times a day, tried treating him with flufenazine, antihistamines, vitamin B1 injections, vitamin mineral supplements, fumigated stalls. He also had other behaviors which are not typically correlated with mutilation, where he developed gastric ulcers, and that had to be treated. He started engaging in pica and eating the dirt in the stalls, and he ended up with sand colic, which had to be treated. They went, because he then eventually started doing cribbing behavior, which is where an animal, and this is also something that only occurs in stalled animals. Neither cribbing, well, very rare reports, neither cribbing or this type of behavior has ever been reported in feral animals that are out on large pastures or ranging. Cribbing is a very common problem with horses that are stalled. They will grab the bar of the cage that they're in, their stall, and bite down, and then release. And what happens is they wear their teeth down, they are predisposed to colic. So he started cribbing, which is also often associated with ulcers, gastric ulcers. So he was treated for all these things. Owner tried everything they could. The literature says that turn them out, you can turn them out, give them social companions, give them a donkey, turn them out in pasture. The chance he's going to hurt another horse is less than the chance he's going to hurt himself. Maybe these things work, but you look up at the literature, and these are all suggestions where it might have worked in one horse. But this owner doesn't have a ranch, doesn't have any place to turn the horse out, and who is going to turn a horse out in a pasture that is doing these things with other horses there? Owner decided to send the horse back to, oops, now I have to get out of the video and go to the next slide. Oh, yes, now the slides. Interesting sequence. The behaviors this horse is showing are very similar to intermale interactions between stallions and aggression between normal stallions. But instead of directing these behaviors to another stallion, the horse is directing it to himself. There's a film called Cloud, Wild Stallion of the Rockies, and I didn't get permission yet to show the clip. But if you want to, it's available on Nature and Netflix. And what you'll see is normal stallion interactions. They go through a lot of ritualistic behaviors when they meet each other. They sniff each other's inguinal areas. They defecate on stud piles. They take turns defecating. They engage in snapping and fighting with each other's legs. It's a very common play behavior. And if you look at the sides of this stallion in this film, you'll see he's got wounds along his horizontal surface that's imparted by the other horses, not him. So what's really interesting about this syndrome is it's a combination of a lot of species-typical behaviors, but directed at himself as opposed to other horses. Horses are a social species. They're raised in groups. Okay, so the little spinning horse went back to New Mexico to where it was raised, and the person who has him now says all he does is spin and chase his tail, and he's perfectly normal. So that's that history.
Hello, I'm Mark DeAntonio, and I'm very excited to talk today, and moving on from stallions to teenagers. In terms of self-injury in adolescents, currently there's, in the last decade or so, there's been a lot of talk about this, but this is not a new phenomena. Adolescents have been self-injurious forever, at least in this society. It's been more popularized and more talked about, but it's a phenomenon that's always been there. And for the majority of adolescents, it reflects part of trying to do this huge developmental jump from a child who is everything really is pretty much controlled, protected, and structured by adults to becoming an adult. And so this phenomena you usually see in the middle school, early adolescent period, where adolescents become overwhelmed by emotional, certainly with the onset of puberty, more emotional instability, physical changes, hormonal changes in their bodies, and also having increasing tasks where they have to be functioning more independently in terms of social tasks, cognitive tasks, decision-making tasks, and they become overwhelmed. In a way, adolescents become overwhelmed. Manage and try to cope with overwhelming is a variety of self-injurious behaviors. And these can be behaviors that one doesn't even think of self-injury, like excessive exercising, some hair-pulling behaviors, various some kind of aberrant eating behaviors that aren't classically either bulimia or anorexia. But you'll see a whole kind of explosion of odd in reflection self-injurious behaviors. But many adolescents get into finding that cutting oneself with objects, doing kind of superficial cutting, is remarkably soothing and distracting. And kind of once they start doing, they keep doing it. Like with the owner of the stallion, when parents see their kids cutting themselves, they go berserk. It's a very provocative thing for parents to see their child in such kind of distress they would harm themselves, even though in the vast majority of cases, what they're actually doing is fairly superficial. And certainly adolescents often are much less concerned about it than parents, who really get incredibly distressed and very upset. So I think you could see that with owners of animals that they're very connected to when they're doing the same thing. It really challenges them that they're doing something wrong. They need to come in and protect them, need to come in and intervene to keep them from being so self-destructive and harmful. Well, a large percentage of adolescents who perform this, really, it's part of, one could say, maladaptive, but a coping style in adolescents, especially early adolescents, that does resolve over the time on their own. And that's what happens with the majority of cases, whether you intervene or not. And often it's never even known by adults, either teachers or parents, that it's even happened. It also can be a sign of more severe psychopathology, and developing more severe psychopathology in the adolescence that carries on to adulthood. I think when one thinks of the psychopathology, I think one trap or mistake is to see self-injurious behavior as a disorder itself. I think a more accurate and helpful way to think about it is that it's when it really becomes pathologic or very disruptive or very dangerous, it really is a symptom of an underlying psychiatric disorder. And it really can be almost any disorder. I've seen it in everything from people who are autistic to people who have been abused, to people who have mood disorders, people who have learning and attentional problems, who are just overwhelmed with the cognitive challenges of academic work in middle school and high school. And so really the critical way to understand how to treat it, and also understand what's causing it and the direction of treating, is to understand the underlying psychiatric disorder and how self-mutilation relates to it. Treatment, there are both psychotherapeutic approaches and psychopharmacologic approaches. Psychotherapeutic approaches, really, part of it is developing with the patient an insight into what's driving or what's behind the behavior. However, sometimes that insight is not enough to stop it. It's remarkably self-reinforcing. And even if the issues around what started the self-injurious behavior are elucidated, often adolescents will pursue the behavior, continue the behavior, And then you move to kind of what's called more cognitive approaches, and they use terms like cognitive behavioral therapy or dialectic behavioral therapy, DBT or CBT approaches, where you work on seeing other ways that a person can self-soothe or modulate disturbed feelings and experiences, better understand what the triggers are, and ways of distraction or substitution, ways of learning calming oneself, relaxing oneself, and developing a wider repertoire of problem solving when they're distressed. In terms of pharmacologic approaches, there have been people who have talked about self-injurious behavior as that what it does is it induces endorphins and enkephalins release in the brain, and the person becomes addicted to cutting themselves like a heroin addict. And so then using drugs that block opiate receptors like naloxone or naltrexone to treat it. I mean, this is a theory that there actually is no evidence that it works. Clinically, it doesn't work. Sometimes it works, I think, as a placebo, that I'm taking this pill to control it. But I think the dynamics of self-injury are beyond opiate release, and that all these individuals are really drug addicts. I think it's the wrong approach, and really the psychopharmacologic approaches are based in dealing the underlying disorder. If it's depression, you use an antidepressant. If the problem is attentional problems and overwhelmment, you use a stimulant to address the attentional problems. And here's just a case vignette that illustrates an individual with a more complicated, severe form of this. This is not the standard, just developmental thing that will go away, but an individual that has a more severe and persistent form of self-injury. KS is a 14-year-old female who presents in an outpatient clinic for evaluation of depression. She has a history of depressed mood, low self-esteem, suicidal ideation for the last 6 months. She was sexually molested by a neighbor multiple times as a child. For the last 2 years there should be intrusive memories of abuse. She started cutting herself with razors on thighs 5 months previously after being told at school in health class that depressed people cut themselves to feel better. Found that cutting self transiently made her mood better, but the effect wore off 2 weeks before current visit, increasing thoughts of suicide. Family history of bipolar disorder and depression in first-degree relatives. Patient diagnosed with major depressive episode and post-traumatic stress disorder. Prescribed fluoxetine 20 milligrams a day and psychotherapy. 2 months later, depressive symptoms significantly controlled. However, patient now dating with first boyfriend, which provokes PTSD symptoms reemerging that are now relieved by cutting on wrists. So initially, the cutting was around managing depression, and now all of a sudden she uses the same behaviors to manage intrusive thoughts of molestation while trying to sort out an intimate relationship with appropriate intimate relationship with a male peer. Self-injurious behavior finally controlled 1 year later with intensive cognitive therapy. So some similarities to the Stallion case. I think the main thing one thinks of when you have children who are self-injurious, that it's a red flag that they're in distress. One has to evaluate what's causing the distress, how it's related to other severe psychopathology or events in one's life, and use that as a guide to manage it or treat it. Although, paradoxically, sometimes when you address the issues, whether it's depression, issues of abuse, the behavior still persists and takes further cognitive and other strategies to manage. Thank you very much.
Thank you. I just want to start before you guys take it away. Both topics are so fascinating, and of course the challenge with behavioral cases is to really ask the question, what is truly translational and what is not. And we don't want to be overreaching, we want to be skeptical, and yet there are parallels, I at least think, that are relevant and we should pay attention to. I guess my first question would be, in hearing Dr. Voith, you talk about the Stallion's behavior, the self-injurious behavior as being a kind of displaced aggression out that would have, that the activity would have been directed at other stallions had they been present, and that it's now being directed towards himself. And I wondered, Mark, Dr. DeAntonio, when you hear that, whether that makes sense sort of psychodynamically or otherwise, or what your thoughts are.
I mean, I think there's a subgroup of adolescents who are very angry at the world around them. They may be victims of bullying, and they're inhibited or afraid of kind of expressing that, enacting that, so they turn that on themselves. That is a subgroup of adolescents. I think that somewhat similar to that. I think it's a little complicated because it sounds like this normative behavior of stallions is to be aggressive with other stallions, and then they can't do that, so they do it to itself. I don't know. It's certainly, I could have a subgroup, I could make it up, that there is some adolescents, that part of what adolescents do to help modulate behaviors is intense social interaction. Anyone who's around teenagers, they're on Facebook, they're on internet, they're interacting with each other all the time. And that helps diffuse a lot of the angst and drama that they have. And a subgroup of kids who don't feel comfortable doing that, they kind of turn all that energy and all that overwhelming and stuff on themselves and could be cutting. So I could make a parallel in some cases.
Yeah, I don't think of these stallions as being angry or aggressive. Because this is a very unique syndrome in that there is a whole lot of ritualized species-typical behavior that this stallion is exhibiting that has nothing to do with attacking the other horse. It's running and snaking behavior and the defecating on the stud piles and a whole sequence of inter-horse interactions, but there's no other horse there. Typically, horses with this syndrome are isolated. They're often raised alone, and this horse was extremely isolated. The only animal on this farm, the only horse on this farm, had been alone for 4 months. And if you look at horses as they're developing, they play. They play with other horses just that way. They bite at each other's legs, but they don't bite very much. They are motivated to play because they're youngsters, and they play with each other. This horse has nobody to play with. So it's chasing its tail, and then when stallions meet each other, or they're highly aroused by mares in the vicinity, which is what happened when he went to the second training facility in New Mexico. It was a breeding operation. So there were other stallions there. The eliciting stimuli were other stallions, estrus mares, and that's when he really started going after himself. So it wasn't, I think, that he was angry. I think he was motivated to spar with another stallion, perhaps, but he can't because he has no access to them. So he begins doing these behaviors himself. And but what I find fascinating is that there's so many different ritualistic behaviors that are typical species repertoire that are happening. It's not just I kick now and then, or I bite something now and then. There's this whole sequence of a behavior pattern that's being expressed almost related to himself as opposed to the natural environment he'd find himself in.
Well, let me chime in there a little, because I think that, again, this lack of companions, it was really well demonstrated by Harlow, who deprived his monkeys any kind of peer interactions, and he studied what happened to these monkeys subsequently, and obviously they were socially very clumsy individuals who could not relate to others subsequently. So again, when I watched your video and heard your story, I could not help but think about the parallels. That what we see is that, again, I came back to the idea about having just one friend that helps in terms of bullying, but we know that kids who don't have friendships, but in that case, we are often now talking about individuals with special needs and a particular group of individuals who are probably getting a lot of attention right now is kids with autism spectrum disorders. So when they don't have friends, when they can't learn to interact with so-called normal peers, then their social interactions cumulatively come looking stranger, and indeed the subsequent adjustment outcomes are going to be more problematic.
There's so many topics you guys could cover. Please just...
There's a veterinary behaviorist who was primarily an anesthesiologist, so he loved to use drugs on anything. And he did find that opioid blockers stopped the self-mutilation in these stallions, but you couldn't sustain it because it was a short-term IV, and there was no way to therapeutically use it. And I don't think he was trying to look for mechanisms that might be involved, but it wasn't anything that could be used, and I don't know what other side effects might have been occurring with that. But anyway, I also was thinking with the pandas, the reproductive things, these animals and people are so out of their natural evolutionary social systems and environment, you're starting to get these other pathologies and behavior patterns that are creeping in because we don't have a normal social system that we involved with.
And like the case that I presented with Harper and Ramsey, if they were, the wild pack of corgis, there wouldn't be any issues because they signaled appropriately. I mean, and as veterinarians, we can read our animal's body language. We know when the shepherd is going to bite us, but probably 3 hours before they do. So we can really recognize those signals. And if we can recognize them, we know the animals can recognize them. And often with these dogs, it's frustration that builds where the owners either aren't recognizing it or are kind of suppressing that behavior in an inappropriate manner. Sometimes, and I don't advocate let them fight it out. I don't. I really don't. But a lot of these signaling behaviors, it's fun. It's fun to watch them because these dogs respond so quickly, and they're ritualized behaviors where they don't have to fight. I mean, if you're in the wild and you fight, you get infected and you die. So it's really not advantageous to be being injured in a continual manner in the wild. So these patterns are ritualized, and when we as owners and humans interact with it or interfere with it, that's where we start having problems.
I'm just wondering about what about other forms of self-injury in animals, birds, for example, feather plucking disorder or excessive pecking. Do those have, insights for the human side and comparable behaviors?
I don't know. I think there's about four major categories of self-mutilation in animals. One is that they're actually mutilating themselves because there's a sensation there. It's a pruritus, it's a spinal problem, it's a foreign body, etc. And those you really need to do good diagnostic workup on instead of just saying, oh, it's psychogenic. Mm-hmm. Secondly, it's secondary self-mutilation due to another stereotypy. And again, horses with cribbing and biting on stall walls and biting with their teeth, they get worn down teeth. Dogs whose tails are beaten against the wall because they're circling as a stereotypy in a cement run, and they get wounds on their tails, and then that progresses. Then there's another phenomenon which we think of as an anxiety-related grooming behavior. And that could be the feather picking that is more extensive, or the grooming of legs in separation anxiety dogs that doesn't appear to be related to a underlying dermatological condition. Ethologists long ago observed that when animals are stressed, they engage in grooming behavior. Birds will preen, cats will groom, but they also observe that animals engage in scratching behavior. A dog may sit down and scratch when it's in a perplexing situation. Ducks, when they're in a conflict situation where they may engage in a displacement activity, may sit there, may also scratch. So there appears to be a scratching behavior, and I don't know if there's a pruritus related to that, when they're in conflict. And if you watch for that, you'll start to see it. So there may be an anxiety-related pruritus that causes this behavior. And there may be some correlations with people in those, I don't know. The stallion thing with this whole normal sequence, this sequence of a normal behavioral sequence of a species-typical stallion behavior is very unusual. But is there anything like that in people where they engage in a whole bunch of sequences repetitively that could be normal in some circumstances but aren't because they become very repetitive?
Well, it's a little different, but you can see that in people who have obsessive compulsive behaviors. And sometimes they will take normal activities that they normally do that's a routine, like brushing your teeth or washing your hands, and then all of a sudden feel that they have to do it in a certain way for a certain number of times. The behavior is something they should be doing. They should be washing and but all of a sudden it all of a sudden shifts to, if I wash my hands a certain way 100 times, I won't get ill. That something else clicks in it. And what is normal behaviors then becomes exaggerated and abnormal. It may not be self-injurious, but then becomes very debilitating. You know, when someone takes 2 hours to get out of the house after all their cleaning rituals are done, they're late to work, they can't go to school. So it becomes very debilitating to them functionally.
Let's go ahead and take a few questions. And
Dr. Bain, was pheromone therapy considered for Twinkle and Cinnabon?
So pheromone therapy, there's a lot in here that I didn't present. I mean, it was quite an involved process, but the majority of Cinnabon was not a normal cat. I mean, this situation, I mean, Harper, a normal response, at least what I think of. I mean, everything's on a bell curve, and she was on the far end. But whereas Harper and Ramsey were more kind of normal behavior. So with Cinnabon, really abnormal, and almost we're talking about Twink, almost like a pariah cat, which may go along with some of the victim behaviors in bullying, where when they actually were together, she would be incredibly fearful of Cinnabon. So I don't know if you want to comment on that.
Yeah, I mean, you know, again, these bullying comparisons, I think the most fascinating part here for me was that the behaviors, phenotypically are very similar. And so, again, in kids, however, the behaviors surface under certain conditions. So it's almost like, you know, again, during times of uncertainty, when there's a new situation, there's no structure, they resort to these more primal tactics to create the structure that helps them. So the phenomenon is similar, but obviously our treatments are very different. So other than telling owners, respect the dominance hierarchy, we tell the teachers, do not respect the dominance hierarchy.
I have a question. Actually, I'm asking for a comment. It seems like with our pet animals that there is a big component in recent years in cohabitation, this emotional need for attention or attention seekers with animals that used to be pack animals, and they have different hierarchy or different dynamic out in the wild, in the feral communities. And the second question is, if we can correlate this historically with the people demographics and societal changes in last 50 decades, when there were large families, a lot of kids, less family attention or parent attention, and maybe now, maybe too much of attention in the small families. Thank you.
Maybe I'll answer the first or the second question first in regards to expectations. Our expectations of our pets have really changed in the past 20 years. I mean, when I was a kid, you know, my grandma's dog growled at me, and the first question out of my mother's mouth was, "What did you do?" Now the expectation is if the dog does something, they can't do it. So our expectations have changed, and I don't know if it'd be interesting to hear what our expectations in human society have changed.
Well, this may be slightly different. I think what has evolved over time, this is not really addressing your question, obviously, but what has been fascinating to watch, in the case of bullying in the old days, when there was an accusation put forward that a kid was engaging in bullying, parents were appalled, but took action. Today, one of our challenges in trying to intervene with bullying is that the parents are in alliance with their kids. So they're the first ones to say, that wasn't my kid who did it, or that it was provoked. So there are some parallels. Certainly times are shifting, and there are some interesting historical changes.
Some of the literature I've read that indicates that when aggression starts occurring too roughly between adolescents in social groups of monkeys or even canids, that the adult steps in and breaks it up. The adult male monkey may be the one who goes in and separates females who are squabbling or adolescents that are starting to fight. They maintain the discipline. And I've heard, this is all anecdotal, from owners of dogs who have groups of dogs, that often the male dog will go in and grab the muzzle of another dog who's engaging in aggressive behavior and bullying another dog in the household. So there was a role with the adults in that social setting to stop this from escalating into serious fights.
I mean, that was a beautiful example of bystander, intervention. So when another dog intervenes, and I think that, again, for kids, what we're doing is that, because it has to be somebody with a higher status that intervenes. Nobody's going to risk their status and become the next, or increasing the chances that they are the next victim. So for kids, what we tell is that pair up. So you offset the imbalance of power by now being two kids who go and try to defend the victim or the target of bullying.
Right. Let's have one more question. Yes.
My question is about bullying, and it was very interesting that you're focusing on the bystanders. I was wondering if there's any research into focusing on the physical environment, structuring that just from personal experience, having been bullied in middle school and then going to a high school, and of course a different age group, but where in the middle school, lunch was always in the same place, same time, sitting patterns fossilized into a predictable pattern, and in high school, every semester lunch was different. Completely new people would have to figure out how to sit with each other every semester, so no lunchtime cliques could form, and there was no bullying. In my own personal experience,
Yeah, there's definitely evidence that physical structure, there are hotspots, like I mentioned, in schools, and there are situations in which bullying increases. Now, what's really important to realize is that, and we don't have really good data on it, we have some informal observations about this, that where we can curb the most overt types of bullying by restructuring and putting some policies in place, for example, regarding lunchtime at schools. At the same time, bullying does not necessarily stop, but it changes its manifestations. So then we're going to get more of these covert types that we can't detect.
I have one comment on the previous thing, and I think it's interesting about what changes are adolescents dealing with that would make like self-injury or something more relevant now. One major change of adolescence, there is family size, there's electronics, there's all sorts of things that I think that are changes that happen generationally that we think the current generation is always the most challenging, but if one thinks back, there's always been challenges. But one major change in the last 120 years is the onset of puberty. In the 1890s, the onset of puberty was about 17, 18, or 17, 16, and now it's dropped to about 11. And so adolescents are, and this is thought to be due to immunizations, because people don't get childhood illnesses anymore, and somehow that triggers earlier onset puberty, and it in both males and females. And so people are having sexual feelings, hormonal changes at a much earlier age than they've had in the past, and probably less cognitively equipped to handle them. And that could have something to do with self-injurious behavior in adolescence. I don't think it's been formally really looked at, but it's just a thought I've had.
That's fascinating. We should probably talk to some of the experts in in precocious puberty in elephants and find out about their social changes. All right, thank you very much. It was a fascinating session.